many faces that have been such great supporters and friends over the years. We're really happy to have you here. For those of you who don't know me, I'm Ann Gaasch. I'm the CEO here at FamilyWise, and I'm excited to have the chance to share some news and updates with you. I'm also thrilled to have Anna VonRueden with us. Anna is our Chief Strategy Officer, and she oversees our Training Institute at FamilyWise. This is something that we kind of launched like last year a little bit, and but it really is just combining the work that we're doing. It includes all of the work that we do around capacity building in community across Minnesota and even beyond. So over the past year, Anna's been leading the expansion of our wraparound training in Minnesota and beyond. And in a few minutes, I'll invite her to share highlights from this exciting new role that we are taking as a national leader in wraparound. But let me, before we get to that, let me share a few updates with you. So I want to start out because we all know that we're in kind of hard times. And we just wanted to talk for a minute about how we're responding to kind of diminishing community resources. You know, as this government shutdown continues, we are deeply concerned about the impact of lost resources like SNAP and Head Start, among others, on so many Minnesota families. Our staff are working arduously to fill in the gaps. So when possible, they connect families with resources. And sometimes when there are no resources available, they work very hard to find creative solutions that can kind of get around the lack of resources. And then our managers are then reporting to us about the toll that takes on our staff as they work with families with complex needs among funding cuts, especially in housing support. FamilyWise has been a steadying force and a supportive navigator for families for almost 50 years. We've been adaptable and facing challenges in the past, and we will continue to persevere alongside families during this uncertain time. We maintain strong referral relationships with community partners like food shelves, our county partners, housing providers, and schools. And as always, we are working with families to grow their natural support networks that can help sustain them when formal programs aren't available. We're also intentional about our commitment to supporting staff in preventing burnout. Over the past few months, we've held several workshops for our staff centered on reflection, self-expression, trauma-informed practices, and grief. With support from the Minnesota Department of Health, we are offering our full staff team bi-weekly stress reduction sessions led by Drake Powell. We are so grateful for his wisdom and his leadership. They've been an amazing resource for our staff. We also recently held our fall cleaning day and our annual staff retreat. Staff connected across programs while organizing our workspaces and making shared spaces welcoming to visitors. We have an incredible staff team, and it is so rewarding to see everyone come together and learn from each other. And I think the attention that we pay to our physical space is a way of also paying attention to kind of our emotional space and giving staff room to kind of tidy up in many ways. So another reason that we did some recent cleaning was it's been taking place at our St. Paul location. We're very happy to share the news that this week we closed on the sale of our St. Paul building. The building had been underutilized for a number of years, and in the last 6 months, as we've continued to more deeply move supervised parenting visits into community settings, we've seen that the usefulness of that building has really diminished for us. We're excited because this change will both improve our organizational efficiency and create new opportunities to partner with other community-based nonprofit organizations as satellite locations for visits. Look for an announcement next month about our first satellite location. And then switching gears a little bit, in September, FamilyWise launched a new event. It's an ongoing thing that we're calling Pastries for Parents. These bi-monthly breakfasts provide an opportunity for people unfamiliar with FamilyWise to come to our office in Minneapolis and to learn more directly from our staff and participants. We are eager to build new connections with community members and businesses over breakfast. Our next Pastries for Parents event is coming up on Tuesday, November 18th from 8:30 to 9:30 a.m. If you know someone who would like to learn more about our work, please invite them to sign up to attend. Pastries for Parents is just one way that people can connect with FamilyWise this quarter. Another is our Gifts of Community Holiday Giving program, which matches the wish lists of families as community sponsors. Until the end of next week, we are accepting individuals, families, and groups as sponsors for the program. Last year, sponsors provided gifts for over 250 individuals. During this time of year when families are facing, a lot of financial stress, this is a great way for them to support them in celebrating their family connections, and to allow them chances to kind of have celebrations. And then one of our biggest events of the year is right around the corner, and that's the Radiothon to End Child Abuse. This event has been taking place for more than 35 years with partners from across 11 counties, and it raises over $100,000 annually to support children and families in north central Minnesota. We are incredibly grateful to Hubbard Broadcasting for dedicating their staff talent and the on-air time for awareness building and fundraising for child abuse prevention. This year's event is on December 4th and 5th. People can tune in locally or stream the broadcast from partner stations in Brainerd, Alexandria, Wadena, and Bemidji. And then lastly, we are still recruiting mentors for our Bright Beginnings Young Parent Education and Mentoring Program. If you or someone you know would be interested in being a mentor to a young parent for a 1-year period, please contact our mentor specialist, and we can put her information in the chat. And interestingly, as we've looked at these programs, I'm excited to share some of our results. Hennepin County shared data with us about our justice-involved youth in the Bright Beginnings program from 2023, demonstrating that 75% of our young people did not recidivate and 99% were still living in community. Similarly, in our wraparound program, which we'll talk a little bit more about later, Hennepin County data showed that 77% of youth who successfully closed out of wraparound in 2022 had no subsequent criminal justice involvement, and 93% remained in the community. These are really encouraging results when you consider that the recidivism rate for youth is more typically 33%. So to talk more about how we see wraparound kind of growing and expanding, we have with us Anna VonRueden, our Chief Strategy Officer, and she's been leading the expansion of our training programs here at FamilyWise. So welcome, Anna.
You.
And Anna, I'm wondering if you could start out, for those who may not be familiar, can you share a little bit more about what wraparound is and how it supports families?
I can. And I see some familiar faces in the room that could probably even speak to it better than me. Wraparound is a model. It's an intensive case management model that I would say is really intentional, bridging supports and services for families. So specifically looking at addressing mental health needs of an identified youth, of family members, but a really intentionality across community supports. We use the framing like informal supports, which we say to families, it basically is all the people that show up and care about you and are not paid to do so. So how can we take those individuals that we know are long-lasting, folks that I think families are bringing into their space and will outlive therapists, social workers, probation officers, case managers, and intentionally having them walk alongside families while we have these service providers in place. So I think it's just that bridge and that connection and teaming that wraparound staff are doing so that families are able to mobilize their supports, manage crises in the future, and kind of build that confidence so that we have communities raising families and not systems. What else feels helpful in that space, I think, that I'm missing?
Can you talk a little bit about because we say credentialing, can you talk about what that looks like and what the national landscape is around credentialing?
I can. And so high fidelity wraparound is an evidence-based model. There's a few kind of credentialing agencies across North America, I will say. Hennepin County chose years and years ago when we started our journey, a curriculum under Vroon Vandenberg. And so we've kind of been on that journey and gone through enhancements. And today, what we're very excited about is the most recent kind of cutting edge version of wraparound training is inclusive of motivational interviewing. So we've really seen that service delivery kind of strategy lifted up in a lot of different spaces, which is hoping to increase engagement, increase buy-in, and really help staff with the tools to have hard conversations with families and kind of help them with those very first early stages of being ready for behavior change. We don't have a lot of time with families, sometimes 9 months, sometimes a year, a little longer. And so when we're thinking about systemic family struggles, really chronic, serious mental health conditions. Likely, we're not going to kind of cure or fix those in that time frame. And so, how do we kind of dig in really quickly, get some buy-in, stay in conversation, ride some of those waves with families, kind of lift up confidence. I think I keep saying confidence, but that feels like a big part of it. If we know we can do it and we believe in ourselves, we're much, much more likely to take steps forward and try new things, invite new people in our home. So staff go through quite a rigor of that process, both leaning into learning motivational interviewing strategies, as well as being credentialed and receiving competency or showing us that they have competency in the steps of the wraparound process. So it's definitely a big lift. It's definitely a big commitment, but we really believe in it because we want families to receive really high quality support when a wraparound person is coming out to their home.
And just to add, like the confidence thing, I mean, do you think that's also partly so important because so many of the families that are involved in wraparound feel like the systems have failed them and that they feel really hopeless about kind of their ability to make change in their own family?
Absolutely. I think many families that we encounter in wraparound often, and I think hope is a good word. I think they've definitely lost hope. I think they've lost confidence. I think they experience isolation and kind of this really heavy weight to feel like life can't be different. And we know for people to kind of trust us and trust us with a plan that is like a really important foundation to build on is like, do you think you can actually do this? And so kind of goes into our theory of change, which we don't have time for today, but how do we truly build self-efficacy in families and our young people? And I think confidence is a big thing. If we think we can do it and we believe in ourselves, we can start to kind of make steps forward.
That's great. So we followed this path with Rune Vandenberg, and we are like we kind of are credentialed to be able to have our own wraparound program. But can you talk a little bit about kind of the growing wraparound training at FamilyWise and in what other spaces that's happening?
I can. So I think in part due to a really strong investment from Hennepin County, they definitely established opportunities for us as an agency to do what we do really well and to grow in our levels of credentialing. And so I have a unique credential that I was able to obtain that allows me to reach into new sites that are looking to either enhance, so like we might say lo-fi wraparound models, and or really start from the ground up. And whether that's because they have existing case management type roles at their organizations, or they just had a really cool opportunity, got some grant funding, realized that there's a gap in community, and are starting from the ground up. And so I think for my support of those communities and organizations or counties, it really does look like a full systems approach of funding, evaluation, choosing the right staff, policy procedures, and then kind of getting all the way down to like who's going to be doing the work, how are they supported, and how are they learning that. And so across the state, we've been able to connect with some really awesome partners, both internal county folks as well as community providers that have been lifted up and are now running successful wraparound programs and serving families across the state. I think our strong connection with Rune Vandenberg has also awarded us a bit more of a national platform to be sought out and found by other states and entities that are looking to engage in wraparound credentialing and wraparound programming and or enhancing models that they've had. I think the inclusion of motivational interviewing in our Family First Prevention Act has really I think promoted a lot of individuals to think about what motivational interviewing looks like alongside service delivery. And the fact that we have an integrated model, I think has been very, very attractive to a lot of communities across the country and a strategic way to like access sustainable funding for their programs as well. So it's been a very fun journey. We continue to get a lot of interest and reach outs from different states. We have states doing really big things like California, who has most recently mandated that every case management model that they offer across the state that they want to have Medicaid reimbursement for absolutely has to be provided under the wraparound model. So we're seeing kind of really big changes on those levels. And we're seeing kind of small communities rise up that maybe have unique needs, unique populations they want to serve, that are finding cool ways to get the funding and make it happen. So I think one thing I didn't say, um, that feels important is wraparound is a model of serving individuals who are working towards goals. And so, yes, what that looks like mainly in Minnesota is our youth struggling with mental health. But we see it adapted and overlaid across many, many different populations across Canada and America, and where this is like finding success and movement for all sorts of people in different situations.
So as you go in and you start to work with, some of these communities across Minnesota, but then also nationally, what are you hearing about the challenges and the benefits to introducing wraparound?
Good question. Um, I think one of the challenges that I found is I like to parallel the process of learning wraparound and becoming credentialed similarly to the time and energy that we have to put towards working with families. So it is not a week-long workshop training. We are not going to become competent in wraparound and truly utilize the skills. Similarly to not expecting that families also are going to learn new skills and implement those, if we were to come out and spend a week with them. I think if we think about plumbers and social workers and all these other fields that come with a pretty intense lift and to learn the kind of expertise of the model, it's time. So I think a lot of sites may call and say, we've got some funding to do wraparound. Can you get everybody trained by next week? Can you come out? We'll give you a couple days of our time. So I think it's like the wind back of that conversation about how we want to teach people kind of a new skill, and whether or not there's time for that. There's families waiting. There's capacity issues with maybe existing responsibilities of roles. So I would say time is a big one. I think funding, like where in what state people are in, is there a funding mechanism? And so in Minnesota, we've been creative at looking at our targeted case management billable code to be adapted for wraparound, but not every state has some of those opportunities or strategies built in yet. So they may be kind of looking at grant funding and piecing that together in unstable grant funding. And so I think I would say both things, stable funding and just capacity to take on something new and different in what feels like we're all kind of being stretched to do more with less. I would say what is really exciting to people and where wraparound really thrives is keeping families together. So if organizations have goals around keeping families together, decreasing the need of out-of-home placement for young people, permanency plans, individuals returning from incarceration, people trying to escape sex work. So all of those things where we think about bringing folks or keeping folks in community, I would say that's where it thrives. And ultimately, for most folks that I connect with, it's about also a huge reduction in cost. And so we're serving people in community, which is much more affordable, with people who are not paid to care about them, much more affordable, and in the long run, much, much more sustainable, because those communities likely are kind of who's going to continue to be around. I also think wraparound's kind of a cool job. And so you get to wear a lot of hats, you get to kind of show up and be really creative. And so I think it is also a job that has high retention if it's done well and if it's supported well, because it's a really unique way to partner and show up with families. And so I think with reduced caseloads, we have more time with families, more intentionality, and there's not maybe as many kind of boxes around how we get to show up and do our work. So I think it's attractive for a lot of staff. It also is giving them a lot more tools in their toolbox in how we can show up with families and be successful. What do we kind of say in certain circumstances? I think can be helpful in those conversations, depending on what maybe school has or has not taught you about working in community and in people's homes. Most people are not prepared for some of those interactions. or hearing families' complex needs and stories. So I also think it's just empowering to feel helpful in those moments, even if the role we play is just knowing how to be a good listener. So I would say that's probably mainly what I'm seeing.
That's great. So we've talked a lot about wraparound as a part of the Training Institute. Are there other things that you'd want to share about like the work that the Training Institute is doing across the state and anything about your hopes for it over the next 3 to 5 years?
I can. Ann knows I'm a big dreamer. Um, I think one thing that has been very cool to see with this umbrella of a training institute is that, to Ann's point in the front of the conversation, we talked a lot about really this was like a way to package the expertise that we hold. And I think having a very consistent way that we want to show up, both from a values perspective and a logistical perspective. So we do training around peer-to-peer support groups, training around ACEs, training around wraparound. And so, how do we show up and know what we do well and kind of use what each model? So, these are all like accredited models. So, how do we take all the pieces of those that we have flexibility around and ensure that we're delivering them all with the best possible messaging and the best possible kind of monitoring for fidelity? And so, that's been something really exciting to kind of integrate across. I also will say there's always gaps in some of those curriculums. And so, I think learning what's missing and leaning into that wisdom of like what will help people actually use this in practice, and figuring out what some of those missing links are across the curriculum. So maybe workbooks, maybe training videos, maybe building in more coaching time. And I think watching maybe what like a wraparound training would look like if we have built-in education around ACEs and brain science and epigenetics, and like how do we also learn more about the families we're serving alongside learning how to serve them. So I think there's a ton of opportunity, and maybe going back to my answer around some of the challenges of capacity is starting to look at how can we create sort of light versions of these trainings. So maybe as an organization, it doesn't totally fit that you can do wraparound for whatever the reason, but maybe it is that you have enough interaction with families that you just want to learn how to hold a really effective team meeting, or you really just want to know how to better engage with families or young people. How do we kind of almost make agencies like wrap agencies, and what are some of those like really great skills that we can teach when they maybe just for whatever reason have barriers to launch into like a whole wraparound department doing this kind of intensive case management work. So I think there's a ton of opportunities that we can continue to promote and educate, and why there's parts and pieces of this that really stand out and I think help move the needle with families. And how do we take some of that out and kind of teach it on a maybe compartmentalized basis, um, both within our state and obviously across the different training partners that we have. So kind of have big dreams of what it looks like to make sure it's accessible to everybody who is interested in it, and not have some of those barriers of time kind of get in the way, or like funding or other challenges I hear. I think other things that will be fun to grow into as well is just approaching more sites. I think building our depth of bench, building more visibility and awareness. And so, where are we reaching? Maybe places where we're reaching saturation. What else is kind of next? What are those really the opportunities I would say to provide booster trainings or ongoing maintenance of their fidelity, because I think lots of times, right, we have really good intentions. We spend a lot of time and energy implementing great skills and great training. And if it's not monitored, we definitely can see some drift. And so kind of upholding the time commitment and energy that people invested, and providing that in a kind of good continuity of care way too. So
And you've done some of that with kind of the community of practice so when Anna she's talked about like the staff that work directly with families who are facilitators, and then they're always supervised by kind of a coach. And you've built a community of practice of coaches, certainly in Minnesota, is that right?
yes,
Yeah. So,
yeah, I think we all kind of need that peer space, whether it's peer spaces where we're coming together talking about parenting, or there's peer spaces where we're coming together talking about the work we do. So we all have opportunity, I think, to learn and grow together, and I think have a landing pad where we can continue to ensure that there's consistency and fidelity to the model. So that space feels really important to us.
Well, I know we're running low on time, so I want to take a minute or two and give people an opportunity if they have any questions for either Anna or about anything that I shared in terms of our updates. So I just want to open it up if there are any questions.
I have a question.
Sure.
Where are you training wraparound in Minnesota and then outside of Minnesota?
In Minnesota, we have a partner agency in Hennepin County, VOA, Volunteers of America, LSS, their branch in St. Louis County, so they serve across the county. Sherburne County, that's an internal county run model. Pact for Families, it's kind of a collaboration of 5 counties in the West-ish metro. And please don't ask me to list them because I can't ever remember them all. And then we have a new group that kind of reemerged that we've worked with for a while around Hutchinson, and they're uniquely really going to focus on training the parent mentor role of wraparound, which is really exciting. Um, and then hopefully, fingers crossed, if we get renewed funding for some current funding that we have, we will work in partnership with kind of a quad county group up in the northern region as part of a Leech Lake tribal initiative that is kind of collaborating across their adult corrections and juvenile corrections. Kind of a reemergence of something they did a number of years ago with some funding that they lost, and very much resembled the values and principles of wraparound. So reemerging that hopefully. And we built out a unique, we said we indigenized our wraparound curriculum. So we would be very excited about that partnership. Externally, California, Delaware, New York, and Canada.
Great, thank you.
Mhm.
Other questions for Anna or for me?
I don't know that I have a question, but I do have just a couple of comments. So I have been working with FamilyWise and Wraparound for probably 14 years or so. And just, first I forget how fast Anna can talk with such amazing information. I was trying to take notes and I couldn't even keep up.
Right.
The knowledge and the passion and the commitment and dedication to Wraparound at FamilyWise has just been incredible. And to think back from, 14 years ago where things started and to hear, that we're training in Delaware and Connecticut, New York and Canada and all over Minnesota. I just really want to commend you because it took a lot of things, a lot of effort, a lot of time, a lot of trial and error. And to see where your institute, where the wraparound model is today, and what I've learned through the process has been incredible. So, not a question, but just wanted to throw that out.
Well, and I would share that right back at you, Carol. I mean, I remember those early days. We were in it together, and without Hennepin County's commitment and investment, and without like the willingness that I saw from like, so for those of you who don't know, Carol is with DOCCR and works with juveniles in corrections spaces. And the willingness of probation officers and leaders to kind of learn and be flexible and do things a different way, this would not be possible without Hennepin County. So our partnership has been incredibly invaluable.
Yeah, people would ask me that. How do I make this work with our system partners? And I'm like, you need a Carol. And people are like, what's a Carol? And I'm like, let me tell you about that.
A champion for sure.
Yeah, that's the professional language I use, champion. Yeah, I appreciate all the support, and it's been a really fun journey. And I thank everybody for kind of coming and listening. And that is like the one word you can say to me that clearly gets is pretty provocative for me. So hopefully you guys hung in there with me, but it's probably my favorite topic to talk about, clearly.
Well, we're just about out of time. So if you have follow-up questions, you know how to reach out to us. We'd love to hear from you. I just want to thank you all so much for joining us. If you liked learning about our training programs, check out the latest, our blog feature on our website, where you can read more about the training that we've created for professionals in early childhood education. And we hope to see you next year for more conversations. So thanks again for all your time today. It's been wonderful to see you all. And I hope you all have a great rest of your afternoon, and that maybe some trick-or-treaters appear in your life in the next couple days.
Yeah.
Thanks,
Thanks,
everybody.
everybody.
Everyone.